Thank you very, very much, Joe. Thank you very much for coming back, Peter. I keep saying I wish this were happier times, and I'm determined that we will do, when we are out of this crisis, one of these conversations where we'll talk about daffodils or something nicer. But while we still are in it, let's do our duty. So I guess the first question is the UK. Infections and deaths. Can you give us a little bit of a reading on where the direction that we're headed in? And then I've got some follow-ups.
Yeah, so in the UK, we appear to be still on the exponential growth curve. The number of reported cases as of yesterday, end of yesterday, was just over 8,000. 50% of those reported cases have been reported in the last 4 days. So of all the cases we have now, it took about 50 days to get to the first half of our current burden of reported cases, in 4 days to the second half. Now, cases is a difficult number to interpret because we know that some countries do better or worse jobs of testing, and the UK has been pretty lax on testing. It hasn't been a priority. And so we know that we're very much undercounting the number of cases. So the fact that we're seeing that kind of steep increase over the course of the last 4 days is certainly something that's concerning. A more accurate sort of number, and for all of you that are kind of following these various kinds of maps and epidemic curves and things out there, following the numbers of deaths or hospitalizations, country by country or location by location, are probably a bit more accurate or useful than the number of cases, because you're less likely to miss a death from COVID as you are just a case of it. Unfortunately, in the UK, we're also seeing a steep rise in the number of cases. So about 57% of all the deaths in the UK from COVID reported also occurred in the last 4 days. This is not surprising because we knew we were on this trajectory. We should be heartened that, that the steps taken in the last couple of days, if implemented well, will help to flatten the peak. But we know that that is not something that's immediate. A case that's detected today was probably infected a week or two ago. So we're not necessarily going to expect to see a flattening of the curve, even if we're successful, for another week or two at minimum. And this is exactly what's happened in other settings that are sort of earlier on, including Italy.
So if we were to be showing signs of significant flattening, we probably need to be thinking about that in 2 to 3 weeks' time at very best. Is that right?
I think that's right. Now, of course, some measures were taken over the last 10 days or so to slow this down, right? We had this kind of gradual introduction after the government pivoted away from the sort of disastrous herd immunity strategy and then started to ban large gatherings, to close restaurants and shops, to close schools. Stepwise, we did make some gradual interventions. So there may be some effect a little bit sooner than that. But my suspicion is it's going to take this more kind of sweeping change that was made on Monday to really have an effect. And so we shouldn't be surprised if the numbers keep going up for a little bit. That's why it's so important to stay ahead of this virus, because we're now going to be facing this continued surge on our NHS over the next couple of weeks, even in the best case scenario.
Now, I want to ask you a question about the strategy to protect the vulnerable, the 1.5 million people who've been identified somewhat arbitrarily, but perhaps well, to say, let's protect those people. If in fact those people have been self-isolating and kind of protecting themselves, and if there's a really stringent effort to protect them, then we should see a decline in mortality because those are both at risk. But correspondingly, if you take those people out of the numerator of mortality, you should start seeing perhaps more cases of younger people or healthier people showing up as mortalities, which are statistically enormous outliers, but we see them more, and therefore that seems more worrying. But tell us a little bit about that, because I know the numbers are showing up in the UK of sort of, Guardian article today that younger and healthier people, we have mortalities in that population.
Yeah, those reports are eye-catching and troubling, and really important for us to understand and not get complacent, and think that this is only the elderly or medically vulnerable people who are susceptible. There was an 18-year-old who, who lost their life to this virus here just a couple of days ago, and there have been several others. One thing that COVID-19 has taught us so far is to expect the unexpected, right? This is still very young, it's still very early. So some of the received wisdom about who's vulnerable and what's going to happen, I think is challenged every day. And so we should be careful about basing too many policy decisions around very early experience. We need to always be understanding and in trying to keep up with the data, and shifting as as the sort of data indicate, right? This is just a moving target, so that's really important to think about. Now, the idea of isolating the kind of most vulnerable more significantly to protect them, on its face makes sense, right? They're the ones who are going to be the most vulnerable to a severe infection or to risk dying if they get it. So yes, let's take even stricter measures for even longer to reduce their chance of being infected. Earlier on, I think there was dabbling with the strategy of maybe we could sort of cordon off all of the really vulnerable, the elderly and chronically ill, in some tower somewhere, and then let it go through all the rest of us healthy people and get herd immunity while protecting them. Um, for a lot of reasons that prove misguided, right? One, in the real world, you can't do that. And how do you identify all the young people who are on immunosuppressive medicines and have diabetes and things like that? And second, you just can't separate society and cleave it into two, distinct towers like that. All that said, I think the efforts to make sure that the isolation is even stricter for the most vulnerable does make sense, and hopefully will save some lives.
Can I ask, the surge that we've seen, the 4,000 bed hospital at the Skoll Centre, the 35,000 drafts of people into the NHS, this must be good news. The question I have is the sheer volume of beds and personnel going to be the thing that saves critically ill people? Or is it specialized ICU type interventions with ventilators? So all things being equal, a lot more doctors and a lot more hospital beds seems to be a good thing, but could that be giving us false comfort if it's not the right kind of care deployed with the right kind of equipment?
I think it'll help. For some cases, you're not going to be able to replace the need for ventilators and ICU trained health workers, and we know that those are fairly limited. Yes, there are more ventilators coming in, and maybe make it to the point where we have enough ventilators. I doubt it, but we still have to worry about the number of health workers who are going to be able to do that. It's great to see that we're expanding our capacity in the number of beds, including the sort of emergency facility at the Skoll Centre. New York City is doing the same thing at the Javits Center, for those who know New York. And over 400,000 people have volunteered to sort of come out of retirement or help the NHS. I'm one of those people. I'm not retired, but not licensed in this country, but volunteered to come in and help. And so that outpouring of support is great, even if a lot of that is sort of general kind of hospital or medical care. That can take a real burden off the existing hospitals in ways that are going to be really important. So it's late in the game for some of this stuff to be happening. I have some concerns about that. It's hard to see how you're going to be able to integrate tens of thousands or hundreds of thousands of volunteers who have been out of practice in a kind of efficient way on a couple of days' notice. And I worry about the lack of PPE for a lot of those health workers. So there's a lot of challenges here, but given the circumstances, you can only see it as a positive.
Peter, do we, the $1 million question, which is, getting a better range of understanding mortality rates obviously makes a massive difference to both our collective state of minds, but also how we provision peak healthcare delivery. Is there any better data emerging from the last 8 to 12 weeks of what we've seen that narrows the potential spectrum, or we still have a very wide variance?
It's fairly wide. There's been more modeling out there. There's been some controversial modeling reported on today that was unvetted that suggested that half the UK population might have already been infected, mostly asymptomatically, which I don't buy. we're still operating a little bit in the dark, or at least in the dusk, because we haven't done a good job of testing. And so it's really difficult to sort of interpret trends when we may only be detecting 1 out of every 10 cases that actually exist. All we can do is extrapolate from the number of hospitalizations and deaths. There's been a lot of modeling that tends to show that you would sort of reach a peak and a plateau over a period of anywhere from, say, sort of 3 to 10 weeks. We're on that kind of upward trajectory right now. So exactly when that peak happens and how long it takes to slow down depends a lot on your kind of social distancing measures and other things that you're doing to actually flatten the curve. But I think the expectation would be that if we're successful in some of these measures, at least in the UK, and we'll still see a fairly exponential rise over the next couple of weeks, we might start to see then a flattening in the number of new cases and hopefully a peaking over the next 3 to 6 weeks. And then there could be a prolonged plateau and a slow decline from there. But there's still a fairly wide range of uncertainty. And that's why I think that a lot of places that are implementing things like lockdown are saying, let's do this for a few weeks and then let's reassess.
When the cases peak, how long after the peak does it then become safe for us to begin to return to normal? I mean, if you have it peak and there's still a large number of people who are ill in hospital, but we think that we have beaten it, do you have to then wait another 4 to 6 weeks before everybody comes out of isolation? Or at that peak moment, can you say the worst has passed, or do you risk reinfections if people then go out again?
Yeah, it's not necessarily about how many people are in hospital at the moment. It's about the number of new cases that are happening, because that's going to be an estimate of the amount of transmission, active transmission that's still happening. Remember, hospitalizations today are reflecting activity from sort of 2 weeks earlier. So once we start to see a decline in the number of new cases, and that's sustained over a couple of weeks, then we can estimate that at this time we're not seeing a lot of active transmission. Then you can at least start to contemplate what it might look like to ease off on some of this stuff a little bit. Again, the more intelligence that we have in terms of surveillance like case finding will help us understand that maybe there are still some places where we need to be fairly strict and other regions where we can ease off. If we take the experience of China, which had to also institute a very significant widespread lockdown and are now starting to ease up, that was basically about 2 months that it took them to flatten the curve, shrink the peak, reduce the number of new cases to practically 0, as we've seen, and then gradually start to open up. Now, they started easing off in places outside of the epicenter in Hubei province a couple of weeks ago, and are just starting now in the epicenter itself. I would say, just based on the limited evidence we have, that kind of 2-month window would be a proxy for a best case scenario here.
If you get to half the population who are infected, and then you lock down, and then everybody comes out after a period of lockdown, what's to say that the other half doesn't get infected and we don't just get, the other half of the problem all over again? Is there some math or epidemiological reason to suggest that we won't have an immediate blowback 4 to 6 weeks later after that?
That one of the big concerns is the risk of a second peak in infections, and that was some of the argument against being too aggressive about limiting the spread initially, because then you're going to have a whole bunch of non-immune people who are going to be vulnerable, and this is just going to come back again, and maybe it'll come back during the flu season next year at a time when the health system is going to be really stretched. So that is a concern. If we were to have 50% of the population that had already been infected, and if those people have some immunity against getting reinfected, that would actually be a situation that would limit the risk of a second spike, because sort of every other person walking around on the streets is not going to be vulnerable. So you can almost remove them from the equation in terms of the virus's spread. all the stuff that we think about doing, we talk about limiting the spread, is reducing that R naught number, which is about 2.5 to 3, meaning if I get infected, I'm likely to infect 2.5 to 3 others, right? Social distancing, reducing the amount of time that we're coming into contact with one another. All of those measures in their own way bring that number down. And once it's below 1, then you are having less than 1 new person infected for every person infected, and that's when you start to see a decline in cases. If you were to sort of say 50% have immunity, you're essentially reducing that population by half, and you can see how that alone would already limit the further spread of the virus. That's the kind of herd immunity concept, which we may get to one way or the other, for better or for worse, but that's still speculation at this point.
There's a question about treatment from one of our members. Just, I know we keep asking you this partly because we're clutching at straws, but anything to suggest that any of the treatments in the pipeline are showing any degree of promise in the last 24 hours?
The reports we have right now are all anecdotal. So the hydroxychloroquine, sometimes in combination with azithromycin, the one that you hear a lot from President Trump, and then an antiviral called remdesivir. Those are the two for which we've seen anecdotal reports. Now, they were mostly given in settings where people were dying and you were kind of doing the kitchen sink strategy where you sort of throw everything you can at them. And so given one of these drugs was done along with everything else that the doctors could possibly do at that time, and some of them recovered. And so you can say, that drug maybe helped them, but it wasn't done in a controlled way that could really tell us that that was the case or not the case. All of both of those drugs and several others are being studied as we speak through a number of trials, including a big multi-country trial with 5 different arms for different combinations of drugs. It'll still be at least weeks before we have further information. For what it's worth, some of these drugs that have shown some promise are being given out in kind of compassionate use protocols, so we can give them to really sick people because, hey, if it does some good, great. And if it doesn't, or even if it does a little harm, it probably won't make a difference because this person's really sick. But we're still a ways away from saying we have a drug that we think is going to help a lot of people. Hopefully within weeks or months, we'll have more, weeks to a month or 2, we'll have more good news, but day by day, it's about the same.
Question about exercise. A lot of our members are trying to get out and sort of do the healthy thing and exercise, and finding parks and canals completely crowded with people trying to do the same thing, and then very concerned about social distancing, how much space, people should be exercising between each other. Can you just reiterate the sort of best clinical advice in that regard?
Yeah, so the government guidance is get out once a day to get some exercise and fresh air. Do it in a way that you don't come within 2 meters of other humans who are not your own family members who you've already been in proximity to. So if you can do that, that's probably fairly low risk. The reality is, especially in crowded places like London, the open spaces are going to be pavements and parks that are going to get really full of people. And it's actually almost impossible to do that safely. We've definitely seen that over the last couple of days. What I would predict, because it's exactly what happened in Italy and then in Spain and in France actually, is that we may see even stricter versions of the current lockdown. And I wouldn't be surprised if within days or a week that at least public parks are closed, and they might even try to keep everybody inside and say you can't go out and exercise anymore, because it's really difficult to do this in a way that is not going to sort of increase the collective risk. So for those of you who are trying to get some exercise, good. Narrow canal towpath, bad idea. I would say try to go out very early in the morning or very late in the evening, in so much as you can do so safely with darkness and things like that, because it's going to tend to be less crowded. And don't be surprised if this luxury we have goes away within a short period of time.
Final question from me, Peter, is it's a US related question, and that's been following the mysterious brain of Donald Trump, on the one hand,
genius,
casual for many, many months, then a little bit more, concerned, then everything's going to be fine by Easter. I lived in New York for 20 years, and anecdotes there from people in New York is that it is very, very frightening, the rate of increase and the mobilization at the Javits Center, that, as you refer to, large scale, interventions and setting up medical facilities. What's your general prognosis on the US? What's your feeling?
It's not going to be pretty. New York could turn into a Wuhan. We've seen a little bit of a promising trend in the numbers of hospitalizations and deaths over the last day or two that have come down. They've done a better job and been more aggressive at trying to contain this than anywhere else in the US, save maybe Seattle, but have done a terrific job with testing, have been pretty aggressive about social distancing, and have worked to ramp up capacity. Those are the three big things that you need to do. So we can hope and pray that will show some promise. But we know there are pockets like this that are just a few days behind New York elsewhere. There's just been this really interesting dynamic where there's a bit of a blue state, red state thing, I think, where the places where the disease is really active right now are liberal places like New York, California, Seattle, Washington. And it makes it a little bit easier, I think, for things to kind of split into their sort of familiar camps. And the lieutenant governor of Texas yesterday said, "Oh, I don't want to destroy the economy. I'd rather take on the risk as an elderly person of getting sick myself to save jobs," which is an insane thing to say. And in a few weeks, when Texas is facing what New York is facing, he'll be eating his words. Realistically, the way things are going without aggressive kind of federal coordination and support, we could see the US having several Wuhans at the same time a couple of weeks from now, and that wouldn't surprise me at all.
I promised it was the last question, but this was a question from yesterday that hung over, which is about pets, dogs and cats. The question was, should we be keeping dogs and cats, our pets, indoors? Because can they get it and can they transmit it?
Yeah, so I did look into this, and it's a question with incomplete data. So the initial thinking and World Health Organization guidance up until the last couple of weeks ago was that dogs and cats, at least, do not appear to be vulnerable to infection or transmission. Therefore, no big deal, carry on. There were 2 reports of dogs in Japan whose owners had been tested positive for the COVID-19 virus that had a very low level of virus detected in their own swabs. And it wasn't really clear whether they were actually infected or it was just a very low level of sort of colonization. They didn't show any signs at that time. Those dogs were quarantined. One was a 17-year-old Pomeranian who came out of quarantine virus-free, but several days later passed away. They think of other causes. So there appears to be at least the possibility that those particular types of animals might be able to carry a very small amount of virus, but it was such a small amount that the veterinary community does not appear to think that it's a high risk for transmission. So the current guidance is, please don't send everyone's pets away to be slaughtered. There doesn't appear to be much risk here. They don't appear to be vulnerable to infection. We don't believe there's a risk they could transmit it from, person to person. But use good practice in terms of sort of washing your hands after cuddling your dog. WHO said don't kiss your pets. And I guess I would add to that, it's a gray zone, but it probably makes sense to keep your animals within your sort of home bounds if you can, and not let them at least run free. So I think the risk is super duper low, but we can't say it's zero. So just that little bit of caution, mostly around hand washing.
Amazing. Well, Peter, thank you so much as always. Wildly useful and engaging. This is both watched by loads of people live and by many, many, many more people when we broadcast it. So a tremendous service, and we're very, very grateful to you.
Yeah, my pleasure. Stay safe, everyone. And we'll see you next time.
Stay safe and stay well. Ciao. Bye.
Cheers.